Hello, everyone. My name is Christopher Wilson. I'm a professor at Loma Linda University. And today, what I want to talk to you about is bioelectronic medicine and how that relates to spaceflight and how and where I see that going over the next 10 years. So, what is bioelectronic medicine? Bioelectronic medicine is a relatively new field. I would say that most of the elements that incorporate bioelectronic medicine are not new. And here we're talking about things like neuroscience, biomedical engineering, and molecular medicine. This is sort of the nexus of all three of those fields. Major targets for bioelectronic medicine are peripheral and the vagus nerves. And what I'll be talking about today is some of our work looking at vagus nerve recordings and vagus nerve stimulation. And the purpose of this is to exploit the body's neural circuitry to jumpstart therapy or modulate therapy or improve autonomic outcome, maintain autonomic balance. Those are the kinds of ideas that I want us to flirt with today as we're talking about where we see this going over the next 10 years. So the vagus nerve innervates the viscera. That includes the lung, the liver, the intestines, the spleen, the heart. Of course, it's a mixed nerve, so we have both afferent information coming up from the viscera into the brainstem, and that first synapse for that information is in the nucleus tractus solitarius. From there, in the brainstem, that information can be carried to the cortex and other regions of the CNS. And also, we see essentially a loop that goes from the afferent side of that visceral input to an efferent side where control circuitry also is used to manage things like sympathetic tone for managing the heart, contractility and rhythm, also immune upregulation in the spleen, and control the gut. So it's a long loop essentially, and it makes up what is called an anti-inflammatory reflex. And we'll talk about that more in a minute. So the vagus nerve, as I said, has both afferent and efferent branches of communication with the viscera. It's the key interface between the CNS and the autonomic control circuitry in the periphery. So anything that happens within the interoceptive environment, and here we're talking about all the viscera, even the vasculature, all of that information is carried through these interoreceptors up to the CNS, and the nexus is at the nucleus tractus solitarius. That's where we spend a lot of our time. So one thing that's interesting about this, or an overarching theme that I think you'll see, is we don't really understand all the physiology of the vagus. So I'll talk a little bit about the history of using things like bioelectronic medicine and vagus nerve stimulation in particular. But one of the things we don't quite understand yet is what are the detailed mechanisms by which vagus nerve stimulation or stimulation of other peripheral nerves can impact our health. So that's an area of active investigation. Kevin Tracy has been working in this area for a long time. This is a summary figure from Nature, a paper that he wrote back in 2002, but he's been working on this for about 20 years, what he calls the anti-inflammatory reflex. And here, basically, we're talking about vagus nerve information coming up to the CNS, being projected through the cortex, and then a cholinergic anti-inflammatory reflex that's mostly efferent information carried by the vagus and its branches down to the heart, the liver, the spleen, and the gut. And what happens here is when you get something that stimulates this anti-inflammatory reflex, like stress or something else, or some pain or changes within the viscera, that information is carried back down. Acetylcholine is released, binds with acetylcholine receptors within visceral targets, particularly the epithelium. And then we see production of pro-inflammatory cytokines like IL-1, the cytokine tumor necrosis factor alpha typically, and the alarmin HMGB1. So he spent the last 20 years sort of quantifying what happens when you activate this anti-inflammatory reflex and what kinds of pro-inflammatory cytokines, anti-inflammatory cytokines, and alarmins get released in response to this. So one of the things I want to point out here, though, is TNF alpha does different things. So it is both pro-inflammatory in some parts of the body, particularly in the CNS, and it is also anti-inflammatory in the periphery. So it's a little bit confusing what the role of TNF alpha is unless you know exactly how it's acting within a given circuit within the body. And of course, interleukin 1 and interleukin 1 beta, particularly, are pro inflammatory cytokines that are released and cause upregulation of inflammation and immune response. So, what's happened in the past? Past uses of bioelectronic treatments include Roman Emperor Claudius's physician Scribonius used electric torpedo fish to treat gout, which is an inflammatory disease. So he was using a bioelectric source of stimulation in order to knock down inflammation and improve outcome for his patients with gout. Now, back in the 1880s, J.L. Corning was experimenting with vagus nerve stimulation, and he found that he could use vagus nerve stimulation to treat epilepsy. So that was something that he pioneered in the latter part of the 19th century, and that was still used to a small degree. There's very little work in the early 20th century and mid 20th century about this. So not much happened until the 1980s. And then in the 1980s, the FDA approved clinical use of vagus nerve stimulation for the treatment of epilepsy. So drug-resistant epilepsy was a big problem. And when we have patients who have epilepsy or seizures, we can give them drugs, but it suppresses so many other things, and it's not a great state for those patients to be on, that neurologists and neurosurgeons were trying to figure out a way to treat these patients without putting them on these drugs that are so debilitating in so many other ways. So they look back at this literature, and of course, some people were still working on vagus nerve stimulation experimentally, and they found that they could use vagus nerve stimulation to knock down epilepsy, drug-resistant epilepsy particularly, and improve outcome for their patients. So in 1997, the FDA approved the use of implantable vagus nerve stimulators, and I'll show you those in a minute, to treat the partial onset of seizures. Now, one of the side effects of this, I guess, is we also found that treatment of epilepsy with VNS also improved mood and outcome. So, in the latter part of the 1990s, early 2000s, there was this realization that you could use these implantable VNS stimulators to improve outcome for depression and alleviate depression. So that was investigated in a number of clinical trials, and the FDA approved using VNS just for treatment of recurring or chronic depression in 2005. And still to this day, the only two fully FDA approved uses of vagus nerve stimulation are treatment of epilepsy and treatment of depression. So there's a lot of research going on. I'm going to talk to you about that. This is what the implantable stimulator looks like. So there's a battery pack here with a Hall effect transistor. There's a spiral electrode wrapped around the left vagus. I'm not going to go into too much detail about why the left vagus here, but suffice it to say, there are a number of contact points between that stimulating electrode and the vagus nerve itself. And when a patient begins to feel like they have a seizure coming on, they can use a magnet to activate this generator. It's implanted underneath the skin, just above the pectoral muscle, and that allows them to often completely arrest that seizure, prevent that seizure. And it's very similar for patients who are suffering from depression who use these implantable VNS stimulators to treat depression. Now, in my laboratory, what we've used is implantable cuffs. So they're sort of similar in the sense that they wrap around the vagus nerve itself, and we've also experimented a little bit with transcutaneous stimulation or very small stainless steel pad electrodes that we can implant underneath next to the vagus nerve itself or wrapped around the vagus nerve. We usually use rat models in our laboratory, and we induce an acute inflammatory response by injecting LPS or lipopolysaccharide into the airways. And then we can monitor vagal traffic up to the nucleus tractus solitarius and quantify what's happening in terms of cytokine expression within the neurons that are within the NTS. Because we've shown previously that when you stimulate the vagus nerve afferents by injecting some pro-inflammatory stimulus in the airways, we get increased traffic here that causes upregulation of pro-inflammatory cytokines and increased production of these cytokines within the CNS at that first synapse. So one of the things that we've been working on over the last couple of years, we've been NIH funded to do, is block the vagal afferents using selective stimulation protocols to try and prevent that pro-inflammatory signal from reaching the CNS and then causing a lot of the enhanced neuroinflammatory response that we see with something activating the viscera. So here's data from our laboratory. We've shown that vagus nerve stimulation can attenuate things like IL-1 beta. Here we have the counts per micron. It's basically a way of normalizing the number of cells that are expressing IL-1 beta. We use bright field immunohistochemistry or fluorescence immunohistochemistry. And we use different treatments here. So here with a sham, we just open up the neck, we expose the vagus nerve briefly, and then we close the neck back up. This is what happens if we inject LPS. We see an increase in the number of cells that are expressing IL-1 beta, producing IL-1 beta, and housing IL-1 beta within the nucleus tractus solitarius in the brainstem. If we inject saline, we see a little bit of an increase over the sham, but not much on average. And here's the interesting thing. So with LPS, we see this broad swath of expression of IL-1 beta. If we use our vagus nerve stimulators at 10 hertz, 100 hertz, 1000 hertz, or 10,000 hertz, we can actually suppress the IL-1 beta production within the NTS and the CNS. And we see that this basically has a predominantly beneficial effect at 10 to 100 hertz. By the time we get to 1,000 hertz or 10,000 hertz, it may be that we're inducing a certain amount of inflammation. So there's sort of a magic range of 10 to 100 hertz for IL-1 beta suppression with our vagus nerve stimulation that works really well. The current varies depending on the animal, but it's usually about 1.2 to 2 milliamps for a given animal. So it does vary a little bit, and that happens in human patients as well. Neurologists and neurosurgeons have to sort of tune the output of those stimulators in order to suppress seizures and prevent any other side effects that are due to higher current stimulation of the vagus. So that's normal for the current to vary a bit. TNF alpha also is knocked down very similarly. I'm not going to talk too much about that here. Remember, I mentioned there's a difference between TNF alpha and IL 1 beta. So, what about clinical research using VNS? So, sepsis, pain management, and cardiovascular disease are all currently being actively researched in terms of whether or not VNS can benefit outcome. There's very good, promising early data for cardiovascular disease arrest or attenuation by using vagus nerve stimulation. Recent technology from Setpoint Medical. Here's our normal implantable stimulator that you've seen in the last couple slides. Here is their new version that basically is microscopic essentially, and that wraps directly around the vagus nerve. Here it is implanted in a patient in this artist illustration. There's a bracelet that has battery charge for that particular stimulator. Notice it's very small. This is a wireless system, and you can control the stimulation using an app on a mobile device. Now, I mentioned that cardiovascular disease is an area of active research. And one of the things that we found is rather than using implantable stimulators, what we can do is stimulate the tragus of the ear because that's connected to the vagus. And a number of investigators, including Dushar's group in England, Savrakis and Yap and others, have shown that with the vagus nerve stimulation through transcutaneous auricular stimulation at the tragus of the ear, you can actually reduce atrial fibrillation, you can reduce the release of tumor necrosis factor alpha in terms of its pro inflammatory effects. So, we still don't know the mechanisms necessarily. That's something that's sort of presently being investigated. Here are a number of different versions of vagus nerve stimulators. Here's one on the tragus. And you can even buy a consumer grade vagus nerve stimulator that's very simple. It doesn't have the tunable stimulation parameters that we use in my laboratory to try and knock down particular kinds of inflammatory molecules. But it is something that you can purchase for about 300 bucks online and use to see if you can tune your own vagus. Now, what's going to happen in the future? Over the next 10 years, what we're going to see is little iPod like devices where we can actually tune our vagus nerve stimulation in a way that will improve outcome. And ideally, I think what we're going to see is a necklace that has the battery pack, maybe sensors that allow us to detect ECG or EKG so we can look at heart rate variability, determine what's going on with our sympathetic and parasympathetic nervous system. We can have a bracelet that will also track our activity and movement, and then ear pods that are wireless that would allow us to stimulate directly. So all of these circuits are relatively easy to build into a jumper or a spacesuit and would be useful for space travelers. So, in summary, I just want to reiterate some of the things we talked about. VNS and other forms of bioelectric stimulation have the potential to be beneficial as a therapy for a number of different diseases that are mostly inflammatory related. So, we're talking about things like irritable bowel, rheumatoid arthritis, obesity related metabolic syndrome, and type 2 diabetes. Over the next 10 years, I think what we're going to see as we understand what's happening with vagus nerve stimulation, that the therapeutic effect of VNS can be used to tune and modulate things like our basal inflammatory tone, balance autonomic function, take care of stress, regulate our microbiome. I think these are all within our reach within the next decade. So, understanding how these things work and bioelectric medicine in particular works to modulate inflammatory tone and balance our autonomic function and affect the microbiome will be key for long term missions, whether we're talking about near Earth orbital habitats, colonies on Mars, or even folks moving out into the asteroid belt. All of these things will be benefited by understanding how bioelectronic medicine can be used rather than relying on the traditional pharmacological interventions that we have done in the past. Thank you for your attention.